above and down onto it. So you're going to try, can you see the little bumps just here, the proximal end? Sometimes they are asymmetric. On you it feels like this is more posterior, if you like, and this is more anterior. So it's almost like, that's what it feels like to me. I could be wrong. So I'm going to bring my fingertips just above it and onto it. It's not very nice there. And I think I can feel this one higher than that one. It looks like it is. Can I get you to shrug your shoulders and back down? Not yet. Off you go. Good, and back down. Slowly, off you go. Okay, and back down. They both go down, and again. Do you have any issues on your right shoulder in particular or not? No. If she says, no, I don't have anything, then what would I do? Nothing, if I'm honest. If she said, oh my God, my right shoulder's killing me, no one seemed to get to the bottom in the da-da-da-da-da, I'd probably say, I probably would try to change that SC joint a little bit. What I mean by that is, if I felt this one stays up and it doesn't want to go down, then my treatment would be to try to encourage it to go down. Does that make sense? Because remember, when the shoulders lifts up, the SC has to go down, isn't it? So if it doesn't want to go down, you might not get pain there. You probably won't get pain there. You'll get pain somewhere here. So if you get pain in this area, a bit like you were pain. So with SC joints, we want to try to make sure that when we do lift your arm up, the SC goes down, and that's what it does. Also, bring your arms forward. So that one would be called a shrug test. Bring your hands together, like this, and then maybe your fingers together. And then if you push your fingers towards the ceiling, like that, my patient's protracted. So she protracts. The SC joint has to go posteriorly. So if I palpate the SC, and then you do that technique, and you're looking to see if they want to go back. And again, the right one, maybe not so fluid as the left one. I can feel it moving, I can feel it moving backwards, but I'm not saying this is fluid as the left one. I don't think my patient would feel that, the difference. But so I'd probably look to encourage a slight posterior movement of the right SC and slight inferior movement of the right SC. Let me just show you how we can work on them, because Leon Chater, who's a famous osteopath, will have techniques where the person's sitting, he comes over and he does this sort of technique where the person's abducting, which is fine. This is a nice little technique. So from there, if you look at this, if I bring the shoulder up, so I'm mimicking the movement, the SC is up now, so the SC is down. So what I want to try to do is maybe rotate your head to the left a little bit, so you're not going to irritate anything. If I look at my fingers and I can get onto the top of the SC, as I bring the shoulder up, what do you think I can do with my fingers? You won't like. I can use my fingers to mobilize that SC joint. It's not very nice, but is that okay?
Yeah.
Sure?
Yeah.
Yeah, from there. If you think about what we can do is, if you push your arm down, so she's doing an MET, and then relax, let go. And then I can then go further up and mobilize it down. See that? Okay, so I can actually do that if I want to. So that would be one way of trying to encourage that movement. Another way, turn your head a bit more, relax there, would be the same thing, probably a little bit more comfortable for them. Not very heavy arms. Use the eminence on your hand. Some people would use a small towel, so it's softer, especially my hands, have to be careful from there. So my healer hand is just going to come in, so it's going to go down as I mobilize it from there. And sometimes I can use like a little thrust without manipulating as such. Thrust, be careful on the word thrust, because you're crossing that sort of line of being manipulative technique. But sort of like a physio would mobilize it 1 to 4, let's say. So you might say, well, it's a mobilizing grade 2 or 3, trying to encourage it to go down. And that would be okay. So that's trying to improve it to go down. Happy with that one? If I wanted to bring it back, if you're looking at this technique, if you bring your arm behind my shoulder, so hook on the back of my shoulder. Now, my hand on the anterior part of it, SC, turn it, relax. Healer hand on there, and I would say to my patient is, hook onto me. So you pull me. So she's retracting for 10 seconds. As she pulls for 10 seconds, relax my hand. So now I'm going to protract. Okay, so I'm going to protract. So I'm going to mobilize it that way. You okay then? So think about movements where you're doing this type of movement is what we're trying to do now. So we're trying to improve it, because if a shoulder doesn't go forward, it might mean that the SC can't go back. So you might find you get pain here, or it's sore there when you do a bench press, but it's because this joint here can't go back. So that technique will bring it back. And then when you lift your arm up like a shoulder press, you get an impingement, it's because the SC can't go down. Yeah? So you can almost do those two quick tests.